Okay, so Marianne, why is this shift in healthcare insurance happening?
Greed.
Okay, you don't have to even
um,
elaborate. That's pretty much, yeah, I'd say that sums it
Greed.
up. Okay, so who benefits?
Everybody but the beneficiary of the insurance plan.
Okay, my next question is who loses and in what ways? You kind of explained that too. Um,
Yes.
how can this be stopped? I know you guys have a lawsuit. You talked about reaching out to elected officials.
So stopping this immediate issue affects city workers. However, we need to open the picture on this. Let's widen the margins because this will affect every tax-paying American as we know it. And how would it do that? Um, these plans, if privatization of Medicare is allowed to happen, it's been identified that these plans are causing a drain of the federal Medicare trust at a faster rate because they've been identified by the Office of the Inspector General as overbilling or committing Medicare fraud in many instances, costing over $75 billion to American taxpayers, the Medicare Trust Fund. If we as a group don't stop this, the Medicare trust will go bankrupt and there will be no Medicare. And then you will be in these private insurance plans and then having to pay premium. Right now, they offer these Medicare plans at a 0% premium because they're overbilling the Medicare trust, CMS, Centers for Medicare and Medicaid. If there's no money in the Medicare trust, which everyone hears is always having some financial trouble, what's going to happen is in order for you to maintain your health insurance, you will end up having to pay premium. Everyone, as we always say, health care is a human right, not a political fight. People over politics. I don't care if you're left, I don't care if you're right, I don't care what you are, where you lean. We can all agree on one thing. Our lives are important, the lives of our loved ones are important, and if we don't have health care that we can afford, then you're going to be making a decision. Do I go to the doctor or do I put food on the table for the family? Or you'll delay treatment and then it'll turn into stage 4 cancer when if you went and addressed it early, it could have been something that could have been addressed. We need to make sure that those are not decisions that people are being forced to make. That, I think, is important.
Okay, and you talked about medical fraud, basically, blowing up the budget for all this. Could you
Yes.
speak on that a little bit?
Well, there's a thing called upcoding. So many people are on Medicare Advantage plans today. So many people are happy with them, and they work for mostly your healthier people. However, when you need to have health care and they're delaying and denying those because they are for-profit companies, this is how they make their money. They do a process called upcoding, these insurers. What they do is they want to come to you and they act like they're helping you or they want to get to know you or they're the good hands people, whatever insurance company that was. They want to come to your house. And when they do, they ask you a million questions about your medications, your medical history. Then they walk away and they go, oh, Marianne, she's a World Trade Center responder. She has all these other issues that are taken care of under this other program, but that makes her a higher risk to us. So we're going to have to ask the federal government for more money. Then they go to Medicare and they say, Marianne's a high risk. She's got all these other issues. We're going to have to get more money from you. So then rather than like $1,000 a month, they're probably asking the Medicare trust for like 12 or 15 or 2,000 a month just to take care of me because of my risk. What they've assessed to be a risk. We've told seniors, don't let them in your home. There's no reason for them to come to your house and talk to you, assess these issues. If you're not having a problem, don't let them into your house. There's really no reason to let them in your house, period. If you have a problem, pick up the phone and call them. But it's been identified through a long series of newspaper articles from Kaiser Health and the New York Times that it's been identified the Office of the Inspector General that these insurers that sell Medicare Advantage plans upcode wrongly, and it's been identified in the Department of Justice as well. So we want to make sure that that gets called out. And Aetna, the plan that they're trying to force us into, is one of those companies that's under investigation.
Staten Islander News Organization is here this morning speaking with Marianne Pizzitola, retired FDNY city worker, and one of the founders of the NYC Organization of Public Service Retirees. Um, right now, Marianne's dealing with significant issues that affect a vast number of not just New Yorkers but former New Yorkers. So, Marianne, for those not familiar, could you just please sum up the background of this whole? I know this is our second interview, so we already went over a lot of it, but just quickly, thank you so much.
So about 2021, we had we found out in the newspaper that the city was looking to remove all of our choices of healthcare plans that we had built up over the decades that worked for retirees wherever they lived around the country, because retirees don't typically all live in New York. A good chunk of them do, but the city had agreed to remove all of our healthcare plans and force us into one plan, which was a privatized Medicare Advantage plan. And we knew that that was a diminishment of our benefit and not what we were promised. So we formed an organization, sued the city several times to this point, and we have been very successful so far. But that's kind of the summary as to what has happened.
Okay, and what about the lawsuit? This is much further along since last time I saw you, which was now almost a year, not quite.
So we actually have three different litigations. The first case was from August of 2021, and that case was to stop the implementation of the Medicare Advantage plan. Is also interpretation of the administrative code that the city has that actually provides for our health care, what the city has to pay for it. We won that case. We won the injunction on that case, which was basically stopped everything. The city appealed. We won the appeal. We went back to argue the merits. We won that as well. Right now on that case, the city, even though they lost in 2 courts and 6 judges with a unanimous decision, the city appealed to the New York State Court of Appeals. So we're waiting for a court date on that. The second case is a class action copay case. We're registering it as a class action. And that was because the city had imposed copays on every service that we had in our Medigap plan, which is that little plan that pays everything outside of the first 80% that Medicare pays. Medicare pays your first 80% of your bill. The city Medigap plan pays the last 20. Well, since 1967, there had been no copays. Once you had met this deductible, you didn't have any costs. Well, what the city wanted to do was make it so painful to stay in the plan that we had that you would want to go into their Medicare Advantage plan. They saddled us with copays that were basically amounting to a car payment for many of us on small pensions. So unfortunately, we sued there. We got an injunction, and now we're waiting for the merits of that case to be argued. The third case is what we call the nuclear option, which we filed the end of May. We filed an injunction and the briefs. The injunction, the judge granted to stop the enrollment of elimination of all of our healthcare plans and forcing us into the new Medicare Advantage plan by Aetna, and that came down July 7th. We won the injunction, and now we're waiting to see what happens next. We're kind of in a holding pattern on all 3 of our cases.
Okay. So, Marianne, through this whole process, what have you learned about the legal system? Your background is you're not actually an attorney, right?
No.
Okay.
No, I know. I think I've turned into one. But, yeah, I joke all the time. I think I slept in a Holiday Inn last night, and today I'm an attorney. What have I learned? It is long. It is a long process, and it is extremely expensive. It's not made for the faint of heart, and as I always tell our attorneys, we have 2 litigation firms helping us. As retirees, we know our case better than anybody because clearly it affects us in the first person. So we are always on this, and when I say always, I mean always. We're making phone calls 7 days a week, late at night, early in the morning, meeting with people, discussing things with retirees. Retirees are cleaning their basements and attics and finding documents going back to 30, 40, 50 years that are actually helping us. So this is what I can say in short is it's a process and it's extremely expensive.
Okay. I know, you had your coworkers back in the day, but since then, like with this whole new process you're involved with, what have you learned about your fellow retirees? Like, what insights have you gained about people?
I love my retirees. We have become a family. We help each other with even stuff not related to this. People will call us, ask us for advice, and we've really formed a bond with them. And I think this goes back to our early union days as we learned really how to organize and be there for one another. When you say, like, in solidarity, like, you meant that. what this organization did was it rebuilt that old way of thinking of how unionism was founded. When you say I have your back, you really have their back. You make sure that you're there for them. Every Friday we close our Facebook page so that everybody can take a break. The moderators, the admins, and even get the retirees off of their computer screens. And we do a Friday night meeting every Friday, usually a half hour to an hour, sometimes longer, where we give an update for the week, and if there's nothing to update, like this past Friday, we just take their questions and talk. Some of them are struggling with other issues, and we help guide them with that. Some of them are related to the advocacy, some are having World Trade Center issues, healthcare issues. They're changing the vendor for the healthcare program for that. Prescription drug problems, dealing with issues with the city, issues with city council members. So we help educate them with those.
Okay. And who are the, the kind-faced people behind you?
This is city council.
Okay.
So you understand, advocacy is not easy, and learning who 51 people are isn't easy either. So what we had to do was, we're always talking about them. We went to the website, City Council, we printed out their names, and then we would tell our retirees to call them, to email them. We set up an email for them. However, you're just saying a name, and if I were to say to you, Joe Borelli, or Camila Hanks, or David Carr, maybe you know who I'm talking about if you live in Staten Island. But if you live in Brooklyn, Queens, Bronx, or Manhattan, you have no clue who they are. So we made a face with the names. So every person you'll see, you have a face and a name. So that way, if I'm talking about someone to a group of retirees, I can show who they are. The other important reason about that is when you see them on the street, when you see them at an event, when you see them at City Hall, they'll walk past you and you won't know who they are. That's a missed opportunity. Teach your people who your elected officials are so that when they see them, they can approach them and say, hey, council member, I'm so-and-so and I'm in your district, or I'm not in your district, but you should get behind this. So that's why we started to do this. Like you've got Joe and David and Camila, and of these three here in Staten Island, not one of them are on our legislation. The other side of that orange stripe, those I'll tilt my computer, those are the people who are actually supporting us. There are 15 members that are on Intro 1099 that was sponsored by, so Charles Barron had introduced our legislation from Brooklyn, and he has been phenomenal to us. He has helped us so much in getting this word out and standing behind us. And as unfortunately part of the Common Sense Caucus that we have in Staten Island, with the Republicans that are on this committee, only about half of our members are on this committee. Why is that? Are on our bill. We have been trying to educate the council as well as educate retirees as to what they need to do and why this is super important that they get behind this. So, but looking at their faces and looking at their names will be able to help make a connection, to people. So I can look up and I can say, oh, there's Charles Barron and I know what he looks like, or oh, that's Joe Borelli, or oh, that's David Carr, and I know the faces, and then that way I can and sometimes people joke, like if someone ever walked into my house, they would think I was a serial killer with all these heads on my walls. But it is really a great teaching tool to be able to show people who your officials are. You might know the name, but you won't know the face. This was the easiest way we could do it. And then I used to do all my podcasts or videos on behind my other side. Now I said, let's do them here in front of this screen. Let's start to get people to know who their elected officials are. This is important, especially as we're moving closer to election season. Okay,
I think it's a great idea. And the thing is the retirees are people, individuals. These elected officials are people, they're individuals. When you just say city council, you see retirees as a group. It's different. You think like a group of people, and it's not like, but that group's made of individual people with lives and stories and perspectives. So
right.
Okay,
it's important to put that name to the face.
Yes. Marianne, why is the Aetna plan being proposed as a replacement inferior? I'm sorry. Yeah, why is it inferior to your current healthcare plan? In what ways is it inferior?
So a lot of ways, actually. You have Medicare covers about they accept 96% of doctors, 96% of doctors in America accept the Medicare plan around the country. When we asked Aetna how many doctors around the country accept your plan. This is how they framed it. They couldn't say 96% or 90% of the doctors in America accept our plan. What they said was 88% of the doctors retirees currently see are in the plan. And I said, what the hell kind of figure is that? 88% of doctors we currently see, there's only 183,000 of us. So if I see 1 or 5 or 6 doctors, only 88% of those. Well, how about doctors in America? Crickets. I get nothing. So I want to know really on a wide range. So not a lot of doctors are accepting this Medicare Advantage plan, and it's not just the Aetna plan. It's like most Advantage plans in general. In the course of our litigation, we have over 500 affidavits where doctors as well as retirees said, I've asked all my doctors and they're not accepting Medicare Advantage. They don't accept the Aetna plan or they don't accept any Advantage plan. So that's one. The other is because they're riddled with prior authorizations, and this is where the insurance company becomes a gatekeeper, where they can delay and deny care. We've also seen that has been proven by the Office of the Inspector General from Health and Human Services. Congress is holding hearings on this exact issue. Aetna is still the same. And even though the MLC or the mayor, City of New York, will say, well, we've suspended temporarily for the first 2 years a chunk of those prior authorizations, the contract, if you read it, says that they can renegotiate those every 2 years. Why would I want to put myself in that situation where after my honeymoon period with the insurer, now you're going to screw me in year 3? Or if they ever need to bargain more and pull rate or value out of the plans like they've been doing to their own plans, they'll saddle the plan with more prior authorization every 2 years to pull out value to use for their own raises, which is what they've been doing. I don't want that to happen to us, and this is why doctors don't want to accept Medicare Advantage plans, is because they actually have to hire a full-time person just to deal with all of the paperwork and that bureaucracy with these insurers. So those are the network, the prior authorizations. These are like 2 major issues. We also have seniors that are in continuing care residential communities. You go in as independent living, transition to assisted memory care or nursing care. They have an on-site medical director. They don't accept Medicare Advantage plans either because the medical director is the one who's in charge, is responsible for your life. So if he feels that upon discharge from the hospital that you have to go to rehab or skilled nursing, you go. Unfortunately, with an MA plan, you have to ask the insurance company, and there's where you'll be denied.
Yeah, it sounds like it's going to interfere with people's wellness. I mean,
yes.
Directly. It's nothing else to it. But
no, you're absolutely right.
Marianne, have you reached out to anyone in other municipalities? Like, is this a problem that goes beyond New York?
Yes. We are helping retirees in Delaware. We spoke with retirees in Vermont, Illinois, Washington. We were in Washington, D.C. We took 70 retirees with us last week, a week and a half ago. It was exciting. Our own national federal elected officials stood with us on a national stage. We had a press conference where they stood side by side, speaking out, denouncing these Medicare Advantage plans. And I struggled to get the people behind me to do the same thing. I don't understand that. Yes, so in actually, and I have to give a kudos to Vermont. So Vermont retirees have been fighting back on their state doing the same thing. What they did was, actually, they were lucky. Their unions came out to support them and said, no, you shouldn't be doing this to retired persons. They're with their retiree organization and their union together, required their Republican governor to pass a law that was very widely supported, that allowed that permitted them to stay in the plans that they were in. And if the state ever in the future went to move to a Medicare Advantage plan, it had to be unanimously approved by 3 retiree organizations, which were listed in the legislation. Never have I seen that before. They are probably the second group that was successful in pushing back on their local legislators in statewide turning their state to Medicare Advantage. So that's kudos to them for doing that. Now we need to do this on a national level.
Okay, so Marianne, why is this shift in healthcare insurance happening?
Greed.
Okay, you don't have to even elaborate. That's pretty much, I'd say that sums it up. Okay, so who benefits?
Everybody but the beneficiary of the insurance plan.
Okay, my next question is who loses and in what ways? You kind of explained that too.
Yes.
How can this be stopped? I know you guys have a lawsuit. You talked about reaching out to elected officials.
So stopping this immediate issue affects city workers. However, we need to open the picture on this. Let's widen the margins, because this will affect every tax-paying American as we know it. And how would it do that? These plans, if privatization of Medicare is allowed to happen, it's been identified that these plans are causing a drain of the federal Medicare trust at a faster rate, because they've been identified by the Office of the Inspector General as overbilling or committing Medicare fraud in many instances, costing over $75 billion to American taxpayers, the Medicare Trust Fund. If we as a group don't stop this, the Medicare Trust will go bankrupt and there will be no Medicare, and then you will be in these private insurance plans and then having to pay premium. Right now they offer these Medicare plans at a 0% premium because they're overbilling the Medicare Trust, CMS, Centers for Medicare and Medicaid. If there's no money in the Medicare Trust, which everyone hears is always having some financial trouble, what's going to happen is, in order for you to maintain your health insurance, you will end up having to pay premium.
Okay, and how can greater attention be brought to this issue? Obviously, you guys are doing great in court, but it seems that visibility, always could be improved for everything. So,
how would I improve it? Improve the exposure of this? I would say more interviews, more media attention, and we need to get everyone involved, not just retired municipal workers. This affects, like I said, every tax-paying American. You pay a Medicare tax with the very first paycheck you ever make, and you don't stop paying a Medicare tax until you stop working. So that's how we have to protect what we have. It is a public health benefit. Everyone, as we always say, health care is a human right, not a political fight. People over politics. I don't care if you're left, I don't care if you're right, I don't care what you are, where you lean. We can all agree on one thing: our lives are important, the lives of our loved ones are important, and if we don't have health care that we can afford, then you're going to be making a decision: do I go to the doctor or do I put food on the table for the family? Or you'll delay treatment and then it'll turn into stage 4 cancer, when if you went and addressed it early, it could have been something that could have been addressed. We need to make sure that those are not decisions that people are being forced to make. That, I think, is important.
okay, and you talked about medical fraud, basically, blowing up the budget for all this. Could you
Yes.
speak on that a little bit?
Well, there's a thing called upcoding. So many people are on Medicare Advantage plans today. Many people are happy with them, and they work for mostly your healthier people. However, when you need to have health care and they're delaying and denying those because they are for-profit companies, this is how they make their money. They do a process called upcoding, these insurers. What they do is they want to come to you and they act like they're helping you, or they want to get to know you, or they're the good hands people, whatever insurance company that was. They want to come to your house. And when they do, they ask you a million questions about your medications, your medical history. Then they walk away and they go, oh, Marianne, she's a World Trade Center responder. She has all these other issues that are taken care of under this other program, but that makes her a higher risk to us. So we're going to have to ask the federal government for more money. Then they go to Medicare and they say, Marianne's a high risk. She's got all these other issues. We're going to have to get more money from you. So then rather than like $1,000 a month, they're probably asking the Medicare Trust for like $12 or $15 or $2,000 a month just to take care of me because of my risk. What they've assessed to be a risk. We've told seniors, don't let them in your home. There's no reason for them to come to your house and talk to you, assess these issues. If you're not having a problem, don't let them into your house. There's really no reason to let them in your house, period. If you have a problem, pick up the phone and call them. But it's been identified through a long series of newspaper articles from Kaiser Health and the New York Times that it's been identified the Office of the Inspector General that these insurers that sell Medicare Advantage plans upcode wrongly, and it's been identified in the Department of Justice as well. So we want to make sure that gets called out, and Aetna, the plan that they're trying to force us into, is one of those companies that's under investigation.
Okay, that's interesting. I know you guys have had some rallies. Have you had any rallies on Staten Island yet?
No, but we're planning one.
Okay. And that brings me to the next question. Are there any plans for the future? We have some readers who do not use Facebook and pretty much, from what they say, shun all media, but they do read the Staten Islander, and they don't really, I mean, I guess they don't go off the island too much, too, so, especially not to the city, maybe to Jersey, but so that's very interesting. Okay. What else can readers do to stop this? Let's say someone's not a retiree and they don't have friends or family, which is probably like 0% of Staten Islanders. But what what do you suggest? Like, I know a lot of people feel something, but how do they turn that emotion into some kind of action?
Well, they can actually do a few things. We have a email that I can try to put up on our website. They're called Action Network emails. You can click a link and send an email to all of City Council saying, I am a resident of New York City and I don't agree with privatization of Medicare. You shouldn't be privatizing Medicare for municipal workers. The people will look around the country. You will have other municipalities looking to see what New York did. So we know that this is already happening, but once New York moves that needle and says, we're going to privatize Medicare for our municipal workers, that will start to happen all around the country. When that happens, you now will have a further decimation of the Medicare trust. So we're advocating that any citizen of New York, or around the country for that matter, should be emailing their local officials, their state officials, and their federal officials. And we have an email, a one click. You click it, you type in your information, where your address is, and it goes to those specific people to tell them, your electeds, that tells them who you are, what you're doing, and you can add change the email to make it more personal, to say, please don't privatize the Medicare trust. When we took those 70 retirees down to Washington, D.C. almost 2 weeks ago, we were very much welcomed by several national organizations, Social Security Works, Be a Hero, Diane Archer's group. These were phenomenal organizations, A.D. Barkin, that said to us, come and join our movement, let's do this together, we need to start publicizing this. We're going into open enrollment of healthcare plans in October, and we all know that the Medicare Advantage plans flood the marketplace, flood TV, flood radio, flood your phone calls, your home with phone calls, with signing up for these Medicare Advantage plans. We need to be able to push that back and say we should be supporting our government healthcare plan, not privatized Medicare plans or private insurer plans. And this is what they can do themselves. When we come to Staten Island, I'll also make sure I let you know that. That way, if any citizen of Staten Island wants to join us. But yes, we are actually in the midst of planning a Staten Island trip, because we have 3 city council persons that need to have a visit to let them know that they need to protect Staten Islanders.
So, Marianne, how can politicians stop this? Is there a process for our elected officials outside of the court? I mean, you're winning in your court cases, but can the politicians just put an end to this?
Yes, by passing our city legislation. We are not taking any chances with the courts. We know that that's why you have appeals courts, because any judge could always rule against us. And this is what we've been saying. I mean, unfortunately, Joe Borelli keeps saying that this should be litigated, and once it's litigated, he'll get back to us. But that's not what his staff told me, and he told me going back last year. He told me, get the bill to the floor and we'll get behind it. He hasn't been behind it, and by forcing us to litigate it, what he's doing is causing us on small fixed pensions to start financing our own protection. What can this body do? This body could pass Intro 1099, which requires the city to provide a Medigap plan and pay for it, because the law currently reads that the city will pay for full cost of health coverage for employees, retirees, and their dependents up to a specific benchmark. Our Medicare eligible retirees plans are very, very inexpensive, and yet if they just pass this legislation, it would be covered. Now, we also have state legislation, Assembly Bill 7866. It was sponsored by Assemblyman Zabrowski from Rockland, and we have just over a dozen assembly persons on that bill already. We're going to start ramping that up for January. Going forward, these would be the 2 things that they can get behind. Staten Islanders should be asking their city council persons to get on that legislation if they're not. Pass that Intro 1099 so that municipal workers can have a Medigap plan and protect traditional Medicare. Call their state legislators and ask them to sign on to 7866. If you have a senator from Staten Island that would like to sign on to our Senate bill, Senate version, we would love that too. and let's just keep doing this, because I think city, state, and federal is where we have to attack this. We're doing all of it: city, state, federal, and litigation. We've got 4 things, like we're juggling like circus clowns to try to see what will be successful first. But yes, legislation can stop this fight now, just like it did in Vermont.
I appreciate that you also said that this is just essentially like part of a larger issue, and that we all need to take a closer look at healthcare. I mean, U.S. healthcare doesn't rank that well in the world, and its cost is exorbitant. So I think the ranking, I'm not sure, maybe you know what the current ranking is for it, but it was like 30 something, and 37th, and the cost was second. So that's grossly inefficient and ineffective, so this could this battle that's happening here now, you guys could win, and then 5 or 10 years down the line the same thing could happen. So what has this shown you about healthcare? I mean, we all have things we have to deal with, health issues, but like, how has this put you outside of your own experience in seeing all this?
Healthcare is expensive. It's become more expensive for your active workers in the city of New York. If I were to focus on our population, I would say our Medicare retirees, we have the least expensive cost to the city. It is where we are seeing costs rise are for active workers and under 65 retirees. But this is a nationwide trend. This is not just the city of New York. Back in 1996, Governor Pataki rescinded a state law that allowed the state to regulate hospital pricing. That was rescinded. They thought that the market would generally regulate itself. That was a mistake. Unless the state then falls back in line with trying to regulate that, I don't foresee that happening again, which is why the council is trying to address this issue on the council level, but I don't believe it will be effective. I think it will only be effective on the state level or federal level, sadly. Addressing those costs nationwide, I know there's a large push. Senator Gustavo Rivera introduced the New York State Health Act. There is still reviews going on about that. Our group is still looking at that legislation to see what changes have been made to it, to try to see if it would benefit, who it would benefit, or if it was, we had some issues about it with not protecting out-of-state retirees. In-state retirees would be wonderful. And peripherally, what we did see is that the plan does offer health care universally for every New Yorker, with no copays, no prior authorizations, no networks, even has a long-term care plan. So it looks good initially. We want to get into the meat and potatoes of the bill to make sure that it's something that our organization would support. For a non-New York retiree, for a retiree from a municipality that did retire from their municipality and left, it would be, from my understanding so far, is that your former employer would then have to continue to cover you as they had in the past, which would be fine, because if our former union leaders like Michael Mulgrew, who happens to live on Staten Island, was looking for healthcare savings, that might be a plan that he would advocate for. So that could be something that he would finally support. His argument to the New York State Health Act was, well, we've negotiated collective bargain for healthcare over the decades, and who's going to pay us back for all the things that we've given up in order to move into a transition to New York Health Act? And we said, wait, dude, that's our talking point. You just stripped away all of our health care plans of everything we negotiated for and gave up during our lifetimes to enrich you. And I didn't get a response back to that either. I'm not holding my breath. But yes, labor, if this is the case, if that's what the New York Health Act is about, then maybe the unions should be getting together this year and saying, you know what, this has been made to look better. This implement-wise has been, to implement this plan would be better for active workers. Let's do this finally and get behind it. And I'm sure the good people at Physicians for a National Health Plan, PNHP, would absolutely love that. And I think that we should be able to form a committee of retired persons and union labor to sit and look at how we can help each other through this, still protect your vulnerable population of retirees who do not have collective bargaining, who do not negotiate contracts, and this would affect them at some level. But the union should be working together on this.
Okay, thank you, Marianne. So what's happening with the elected officials standing with you guys? If you don't mind, could you pan the camera over, let us see those people again? Maybe you could tell us a little bit about what's up here.
Okay, so Councilman Charles Barron is who sponsored the bill, and he's in the top. I guess it's my right, your left. And then Lynn Shulman, she's from Queens. She was one of the co-sponsors. Ari Kagan from Brooklyn, he is also a co-sponsor. You have Ina Vernikov from Brooklyn. She is also a co-sponsor. I think she was second in line. Chris Marte, Shekhar Krishnan.
I think you got to put it down. I'm sorry, down a little bit. The last three people are cut off now. Yeah. Okay. Cool.
How's that?
Yes. Thanks. Okay.
You have Shekhar Krishnan, Tiffany Kavan, Linda Lee, Kristen Richardson Jordan, Vicky Palladino, Joanne Ariola, Alexa Aviles, Shahana Hanif, Robert Holden, and Eric Botcher. And those are our signers so far. That's 15. And then everyone else on this side of my orange stripe here is there, and they are not on our bill. So our goal is to get them all onto that side of the board. We need 34 in order to have a veto-proof majority, because we know the mayor is going to veto this, but we want to make sure that we have enough people to sponsor it and get behind that. We know that the city has paid for our health care as required under statute since 1967. The law right now reads, the city will pay the full cost of health coverage for every employee, retiree, and their dependent, up to a specific cap called the HIP HMO benchmark, and they will pay for all of that. Our plans are about $200 a month. An active workers plan, the one that they traditionally like, the GHI CBP plan, is about $920 for an individual plan, about $2,300 a month for a family plan. And then the benchmark that they have to, that the city will pay up to, that benchmark is slightly under their favorite plan, which would leave a difference between those two premiums. That difference, if it's not paid by the employee, comes out of a special fund called the Stabilization Fund. That fund has been misused over the decades, and unfortunately in 2014, the teachers didn't have a contract for 9 years under Bloomberg, under de Blasio. In order to get that raise, they had to convince the Municipal Labor Committee to give $1 billion out of the health fund that paid for premium for all workers and under 65 retirees. They agreed, unfortunately. $1 billion went out of that fund. They also did some creative savings agreements that suppressed the benchmark, which also caused a further diminishment of that fund. Since that fund has been misused, and it's been reported by the Independent Budget Office as well as the Comptroller, that it's been misused by mayors as well as the committee, because they have to mutually agree how it's used, that fund now doesn't have a lot of money in it, and it's not sufficient to pay everything that it's supposed to fund. That fund, by the way, does not finance a Medicare-eligible retired person.
Okay,
This they should have protected because it protects them. There's a lot of misinformation where people are saying that fund finances Medicare eligible retirees. It does not, because our plans are so inexpensive, there would be no premium difference for it to pay.
Yeah, it seems there's been a lot of misinformation, even potentially disinformation.
Yes, we call that, we call that a disinformation campaign, because that's exactly what this turned into. And knowing the populations that we're talking about is labor, we should not be engaging in this, or council members should not be engaging in this type of behavior, but sadly, you're correct.
So, Marianne, what are the, I guess briefly, the goals of the NYC Organization of Public Service Retirees?
Our goal is very narrow. It's protect and defend retiree health care, retiree benefits in general. We want to make sure that what we left with, we are promised, and we can see them another day. We know we earned them. We know we gave up wages. We gave up raises. We gave up other benefits. I mean, from 95 to 97, we gave up total wages. We took zeros for 2 years. No increases in wages. We took contracts where we had delayed implementation of our raises. In order to sustain this, the one benefit we took is like a kind of a deferred compensation, if you would, for our future. So pension and healthcare was important to us. Our concern, I think, is today's young people don't see themselves either as retired or look to their future, and that's a concern because we know we stayed on the job for 20 years or so, 15, 20 years. We knew that we looked to prepare for our futures. Many of us took this job, even though we knew the pay wasn't great, but because what we would have in our future, healthcare and pension, was worth sacrifice. And it's sad to see that today's labor doesn't look to that, and I think that will also eventually cause more damage to the labor movement. People will not come to, good, hardworking people will not take work jobs with the city of New York because of what will happen, that they know that their benefits that they're working very hard for will be diminished when they're gone, or that their unions that no longer represent them will look to take what they had to enrich them. That shouldn't be the way, and it never was. I think that will harm the unions, and I think it's going to hurt the city, if you asked me my opinion on that.
I think this is like a very important issue for you guys and your families, and it's a springboard to a bunch of other issues. You're talking about labor issues, social issues, the medical system mismanagement. I mean, we do have great technology and advancement and innovation. That's, you can't argue that. But just regular health care for regular people, there are still some serious issues with that, and hopefully this will blow up big time in terms of exposure, and you guys can use this, and the elected officials can use this as a way to start to address all these other issues that, well, why are the costs so bloated? You talk about the upcoding and other types of fraud, medical negligence. It's like a whole lot of stuff. There's a lot of issues that this, calls to mind. So
yeah, for a bunch of retirees, we got ourselves in the middle of like a hotbed of national issues that we didn't expect to be. When I'm standing next to Senator Warren or Jamila Jayapal, the leader of the progressives in the federal level, yet I can't get my own progressives or Democrats in the council to be behind an issue that affects us here. That blew my mind. I'm standing in front of the Capitol next to Senator Warren. This was shocking to me. And then I'm struggling to get the city council to get behind the same thing. Don't privatize your Medicare. Protect labor. Protect retirees. This, I would never have thought would have gone like this. But yes, we've had to come out of retirement. These should have been the years where people should have been able to relax or enjoy their golden years. I have a firefighter who's in Florida who's struggling with his life, who, if he was forced, that needed a plan on the outside, an individual Medigap plan, that plan that pays that last 20% that the city currently gives us. Right now, the city pays $200 a month for that. He was being quoted, because he's under 65 and on disability, he was being quoted $800 a month for that plan. I have another retiree that lives on Staten Island. She is a crossing guard. She makes less than $800 a month pension. She worked for the city of New York as a part-timer doing a crossing guard work for 35 years. So when you think about all of these people, they would never be able to afford to pay up for anything. They were struggling with the $15 copays, that they were putting on us in January. So we have to look at those, because there's a complete disconnect between today's leadership and who the retirees are. We don't make $100,000 pensions. I mean, I'm sure there's a chunk of retirees that do, but those of us that don't, you're forcing us into managed inferior medical care that you wouldn't choose this plan if you could, if you wanted to. For example, and to clarify that, right now the city offers 11 plans for active workers and 14 plans for retirees. You have that choice. Right now, they want to take away those choices and force you into managed care. Do you know that Aetna, United Healthcare, there are Medicare Advantage plans currently in the city network that have been around since 1987 that you could choose if you wanted to, but people don't. So now what they're going to do is, to save money, is force you into an inferior healthcare plan because it saves them at the cost of your life.
Okay. So you guys are clearly doing essential work that impacts people, society, our institutions, our cities. How can readers donate, I guess, their efforts, time, and most of all, I would say funds, considering, you guys are doing a legal battle, to the NYC Organization of Public Service Retirees?
Well, thank you for asking. So our website is www.nysretirees.org. They can make a donation. It tells you how, all the different ways on our website. They could join our Facebook page. If they're not on social media, like you had said, some of your readers are not, they can join our YouTube channel. We do several YouTubes a week trying to expose some of these issues. So that's turned into another very big following. And then get involved. If you sign up for our emails off of our website, it's on the same page, donate/subscribe. You can join our page, join our emails, and when we put a call out for a rally, come and join us. And then do those action networks. Send an email or a phone call to your council members. You know, if they're Staten Islanders, call Joe and call David and call Camila and say, hey, why aren't you on this bill? You should be protecting those retirees and you should be protecting us, because if you look at this at a wider scope, what you do in the city of New York is going to affect New York State, and it's going to affect the rest of America.
And usually we think of union retirees being affected. What about non-union city retirees?
Thank you for asking about that. Yes. So when we talk, mostly because majority of us are union, but there are a lot of retirees that are managerial or were in titles that were non-union. These decisions that are being made by the City of New York and the Municipal Labor Committee affect them too. But they had no one to talk to about it. They found out about this because of us. This would be your city council people who are retired. This would be your former mayors. This would be people who had titles of like managerial or attorneys, people that made policy that were not in unions. So yes, this does absolutely affect them, and they are in our organization as well if they work for the City of New York. Many of them are very helpful to us in different aspects. One of the things that this group does is, because we don't know everything, our board doesn't know everything, we use their talents and knowledge and we help them in the mix of this one big machine of all these different cogs turning, and using the talent that we can to help us get that message out.
Okay, thank you so much. And you mentioned briefly the Medigap plan. What is that?
So when you're Medicare eligible, you're either over 65 years old or you are on disability. Medicare pays that first 80% of your health care, and a Medigap or a supplemental plan pays that last 20%. And that's called a Medigap because it pays the gap that Medicare doesn't pay. It's typically a very inexpensive plan. It could be like $200 or $300. However, that plan, it will pay, like for the City of New York, it pays that 20% that Medicare doesn't. So Medicare gets the bill first, and the Medigap, it's called our senior care, pays the remainder of those bills. These plans outside the marketplace are not regulated on a federal level. They're regulated on a state to state. So every state makes their rules. There's 4 states in America, New York, Maine, Massachusetts, and Connecticut, that have what they call guarantee issue, that you're guaranteed to be issued one of these plans no matter what your age is, or if it's outside of enrollment, or no matter what your pre-existing conditions are. If you're not in one of those states, like I have a New York City retiree that lives in Arizona, she is 55 and on disability. When she looked to not take this Medicare Advantage plan and to stay on traditional Medicare and buy a plan like this on the marketplace, she wasn't allowed to buy one until she was 65, which means she would be forced to pay that 20% of her health care that Medicare didn't cover. So that's why these Medigaps are so important, because for a small cost like this to the city of $200, it would literally mean saving a retiree's life or saving them from bankruptcy.
Okay. And admin code 12-126, 1967. Please talk about this, Marianne.
Okay. So, the City of New York was already paying for the full cost of health care for every employee, retiree, and their dependent. Mayor Lindsay wanted to make sure that he was able to continue that with the advent of Medicare, which came about in like 1965-66. So what he said was, we've been paying for the full cost of health insurance for retirees. What we need to do is continue to give them Medicare, and then not duplicate benefits, but let's carve out the health care plan that they have and give them a Medigap or supplemental plan. That would save the city money, and it would still allow employees and retirees who qualified this beautiful gift that President Johnson gave us of Medicare. And that's what he did. In order to give Medicare to employees, he did it by a personnel order. But he couldn't do a personnel order to give this to retirees. What he did was he asked two city council persons, Mario Marola and Edmund Farrell, please write a law that would allow me to do this. And they did. And that became 12-126. And 12-126 does two things. One, it tells the city what they must pay up to for every employee retiring their dependent, which was the HIP HMO rate. They have to pay up to whatever that plan costs. That's what they have to pay up to for everybody. And then it also pays for the Medicare B premium, that's set by Medicare, because that's the first 80%. The mayor said that since I'm already paying for the full cost of health care, let me continue to pay for this, and that's how that happened. 12-126 was written by the council, passed by the council. It was amended over the decades by the council, and that's what sets the benchmark for the requirement that the city has to pay for everyone equitably.
I learned something definitely just now. I've heard mention of it, but now definitely I have a better idea. Thank you so much. Okay, my next question is, shut it down. Are you guys going to shut down the city, or engage in other direct action? We've seen it for BLM and other groups.
We're getting a lot of push for that. I don't want to let out any secrets, but there's a lot of things that are being talked about, ideas and suggestions, and that's usually a common union phrase. You'll hear it at the rallies for the labor when they're, rallying for a contract. If we don't get our raise, what are we going to do? Shut it down. But what really can a retiree do in shutting it down? And you're right, BLM and Lyft and Uber did it, and there's different ways. So we're looking at something like that. If this doesn't go our way, if this doesn't go the right way, if I can't move this body behind me to actually get on board to do the right thing, if the court comes out against us, and then we'll be looking back towards the council to intervene again, because it's like they're not wanting to intervene, then I think at that point it would be ripe, and it would probably also be cooler, because when we were in Washington it was so hot. We were literally melting in DC, and I was putting my retirees in Ubers and getting them to the train station to cool down, because there was no place to cool down at the Capitol. But yes, I think that would put me into fall, and we are looking to do rallies in a couple of locations at this point. Yes.
Okay, thank you. Now, I see this whole thing as being partially a product of ageism, where there's not the kind of respect that should be given for the elder generations of people who worked, did their thing. I mean, talking with you about this today, I realize there's a lot of issues. This is like a society-wide thing, and it reflects on what you said: greed, a lack of sense of morality. It doesn't even have to be a religious sense. It could be totally secular humanist. It could be your own sense of morality. But it seems amoral to do this to people who worked and put their life effort, into serving the people of, the municipality. So I don't know what to say to that.
Yes, it does. To us, this was a no-brainer. This should have come easy to the people behind me to go, no, this is wrong. Why they're not getting involved defies logic. That you're making retired persons and the disabled fight their own battle when you could be doing something about it. People who are 75, 85, 95. I have a 102-year-old retiree in Florida. That's the oldest retiree that I know. She shouldn't have to worry about this at this stage of her life. And this is really coming, in my opinion, is coming from management and budget. They are the numbers people. Labor relations. You have people who are making decisions that they're trying to push and actually working with the Citizens Budget Commission, which is typically a think tank that tries to save the city money, but it's typically against labor. So if you're putting all of those factors together, we found an article in the New York Times this weekend where Bob Lynn in 2014 was talking about working with the CBC in implementing exactly what we're experiencing today, and I was appalled to see that. Then put in Ken Godner, who's your Deputy Commissioner of Management and Budget. This is a numbers game, and where they're saying that there's no money in the budget, and yet I know there is, and by law they're required to why would you do this? Why would you transfer this to people who don't have the ability to pay? And yet you're telling your active unions, do this to your retirees and we'll give you a raise. That to me is criminal, but yet they're still doing it. How do you change that? I really don't know, but it would take a strong labor movement, which we're trying to get the active unions to listen to. You should not be capitulating to that. You should be standing up to people saying to you, you are labor. Those are my retirees. While I can't represent them, I want to. I will protect them because that is our future. That's what they should be doing. So we've been asking for that kind of a rally cry for a very long time, and they're not listening. I'm not quite sure why, but I think that's where it's coming from.
Okay, thank you so much. Marianne, you are definitely a hero to many people. I mean, I hear the things people have to say about you. They're always good, positive things. And what inspires you? What can you say that could help other people to rise to that level in their own lives and really put the effort in?
This has been an exhausting labor of love. When you listen to people, it's hard to not be moved by them. One of the things we do is a little video where periodically, and I wish I had more time to do these, but we get letters from retirees every day. When people send in checks, they don't just send in a check, they send us a letter, handwritten, in cursive, cards. I get about typically 5 pounds of mail a week from the bookkeeper. They take the check out and then they send me the letters. Well, in the last few weeks, that 5-pound box has turned into a 20-pound box. So to tell you what that looks like, I'll have to message you a photo to show you all of the mail. And we had been shredding them after we were reading them because it's people's words and their addresses, and I didn't want that just in the garbage. I started keeping the boxes, and we created a wall of retiree letters, and people send me paintings and people send me cards. When you read this, it's hard not to be moved. I posted one up on our YouTube channel just this weekend. I was sitting having my coffee with my little Wonder Woman mug and reading a handful of those letters. And it's very touching, what people say, that they're concerned about this for their life, or that they're battling cancer, or that their loved one was just put into a facility because of Alzheimer's, and yet they're worried about their health care, and there's a complete mental disconnect with the people who have the power to stop this, and they're not. So ageism, it's been described as elder abuse. That kind of outpour is what keeps me up at night looking for some other way to try to win this case or move these people behind me to stop me from having to fight this and them from having to fear for their life, because they could stop this. So I figured if I put it in a video and made them listen to it, maybe they would. And maybe that would move the needle to get them to do the right thing. But that's what drives me, is those letters and listening to the calls and the emails and the text messages, is people.
Okay. And, maybe a little bit lighter or not, it's up to you. Can you tell us some stories from your time working for the city? And that could be anything. Just because we all see you in this role of almost like an attorney, and I don't know that you necessarily did this, or maybe you have some experiences, positive, anything you'd like to share.
I worked in EMS. I'm actually wearing a FDNY t-shirt right now. You can see my t-shirt. And that was probably one of the best times of my life. As EMS, you worked with people. You usually were called to help them at their worst point of their life. They were either a crisis, an accident, a domestic violence, a heart attack, or something. And you went in and helped them. I guess so for many of us, there's some of us on our board are police, fire, EMS. We all have that same love of people. So at our times in EMS, people ask us all the time, how are you able to handle all of this that happens? And I said, I think it's from our training from the fire department. Like, we're taught to walk into a crazy scene, organize it, take that chaos, fix it, take the patient and go. And so any different time that we'll have where the city is throwing out paperwork to us or putting in different motions or whatever, we're like, all right, let's do this and let's do that. And like when we went to DC, all of a sudden one of the groups that was helping us came into the atrium of the train station and took half of my people. I was like, stop. We took control of the scene. Don't take my people. Like, we became like Mama Bear with her cubs. So me and Michelle, our secretary, she's also from EMS, she was a lieutenant, we were like, where are you taking our people? Like, we become very protective. Someone sent us a TikTok video of a mama bear helping her cubs across the street. That's us. Like, we became protective over these people because no one was protecting them. EMS was the very same thing. I think my time on the street was very exciting to me. I do miss the job a lot. You had that camaraderie. When we go into retirement, one of those things in transitioning from work life to retired life is that lack of camaraderie, or seeing that 100 people you see every day. It's been 20 years almost, but this kind of brought that back home, and we reconnected with all those people, even fighting for 9/11 healthcare. I went back to the retired firefighters and I said, hey, remember in the day when we were championing the Zadroga Act and 9/11 healthcare? We need to do it again. And all of the firefighters and the cops were like, yeah, let's go, let's do this. So it invigorated a labor movement per se, but amongst retirees that I don't think anyone thought would ever happen. And I definitely have to credit my time as working as a municipal worker in the fire department because of that. Because you can say to an EMS person, our training came in handy in this, that we were able to rally, organize, we can track our people, we can, like on a mass casualty incident, we can tell you who's on the scene, what your patients are, if they're walking wounded or they're not, what hospitals they went to. I mean, we're able to do that with ease. Organizing this, I think, came as a second nature to us, and we thank our training at the city all the time for that. So we had very good experiences working with New York.
Okay, that's amazing. Thank you so much. And Marianne, you seem to be thriving. How does all this give you strength rather than take from you?
Double espressos. It's my secret. It gives me strength to see that as the years tick on by, we're getting more support, state support, federal support, union support. And this is important because I think the unions were lied to. I think they were misled. I think they were sold, like many people are, by watching an infomercial on TV. They were given a presentation by an insurance company, and they believed what they heard, even though it was too good to be true. Like, there was no one in the room, and I think if there was a retiree in the room that would have said, wait, they're selling you the Brooklyn Bridge. Are you out of your mind? How could it be free and be better? Like, no one ever said that. So I think, though, more people are starting to look at this, and they're realizing that outside of the cocoon of New York City, this is being fought on a federal level to stop this, and that corporate greed is allowing it to happen. And the insurers are going to the municipality or the employer and say, you do this, it's a zero premium. And then they go to labor and they say, hey, if you do this, then you put those retirees into this free plan that we're going to give you, then you can negotiate using that money for your raises. And that's happening time and time again. The MTA just did it. And the MTA was sneaky about it. When they sold those two plans to their retirees, actually to their active workers, they never said they were Medicare Advantage plans, ever. The document shows 3 plans going down to 2, and those 2 plans are Medicare Advantage. They never said those words. And we keep saying Medicare Advantage is not Medicare, and it's not an advantage. But people who are young don't know the difference. It's crazy.
Okay, and that concludes my questions. Do you have any comment that you'd like to add for the end, or?
No, I think I would just say, hey, Staten Island, please call Councilman Joe Borelli up there at the top.
Keep going, keep going. There he is.
Do you see Joe? Call Joe Borelli, Councilman Joe Borelli, who is chair of the Minority Caucus. Call Councilman David Carr and call Camila Hanks, and tell them that you want them on Intro 1099 to protect city workers. And then call your state officials, your state elected representatives, and ask them to get on 7866 and sponsor that bill in the Senate for us and help protect New York State workers. And then come out with us when we're doing federal national events, because we are moving this nationally, and we could use all the help that we can get. We'll put up those email lists on our website. one click, you fill it out, and let your elected officials know, local, state, and federal, that you are not for privatizing Medicare and that they should be protecting you. This is not a left issue, a right issue. This is a human issue, and that's what we want to keep saying. So thank you for listening, and your questions were wonderful. You're one of the people that get it, and we appreciate that.
Thanks. I like that you keep putting it in perspective, like you put these issues in societal perspective to realize, wait, this isn't just some isolated thing, and I appreciate that because, you know, we have to think about what society's moving toward, you know. Thank you so much, Marianne. This was a great experience. It was great speaking with you, and do you still work on the cars? I should have asked this during the interview. Do you still work on the cars, or?
I wish I had more time, but yes. So I have my bus, my 71 Volkswagen.
Right. Oh, that's so cool.
And I haven't had time. I was supposed to be I have to finish rewiring the dashboard on that, but I still take it around, tooting around. The dashboard needs to be rewired. I've been working on that a little by little. Not the time that I really want to be able to do it. It really just needs to be knocked out. And then I need to replace the pop top. My other little car is my little MG, it's like a big wheel for me. It's a kit car. It's a fiberglass 1952 MG, and it's on a 1970 Beetle chassis. If you remember, the reason I love that car is because it's on the Beetle chassis, and it's the same engine as my bus, so I know how to fix that, thanks to COVID and YouTube. But yes, I learned how to fix Volkswagen engines while I was stuck home during COVID. So I rebuilt that bus. I absolutely love it. And I'm hoping with the cooler weather and maybe if things slow down, I'll be able to take that and my dogs out and go camping. That's kind of been that was supposed to be my escape, and then I never got to escape.
Well, best of luck with that. And is it okay if I include this part too? Part of
absolutely.
It? Okay, great.
Yeah,
so have a great day and have a great week. Thank you so much for everything you do for everyone.
Good to see you again.
Thanks.
Well, thank you
Stay
for
well.
asking.
See you.
Bye.
All right, bye.